just give me 1 second just to quickly finish this off. And send. Fantastic. Okay, thank you so much for waiting. Sorry about that. So, can I take your name, please? Okay. And do you have an appointment with us today, or are you here for the walk-in clinic? Walk-in, okay. So, what seems to be the problem today? Okay. So that's 2 things. So you've got problem with your eyes and problem with your ears. Okay, you might need to see 2 different specialists. Okay, so let me just have a little check on our system and see who's available today. Would you say it's quite urgent? Okay. Okay. Right, well, you are in luck. We actually have a slot free with Dr. Stormie right now to have a look at your eyes. Okay. And then immediately after, Dr. Periwinkle should be free to have a look at your ears, okay? Fantastic, so I'll go ahead and book that in. Fantastic. If I could just ask you to use the hand sanitizer over in the waiting room, okay? And then Dr. Stormie is the second door on the left. So just knock on the door. She's ready and waiting for you, okay? Perfect. Okay, well, hope all goes well. Good luck. Good luck.
Hi, I am Dr. Stormie. Very nice to meet you. I am here to perform the Orbital exam on you. Okay, so I'll be putting on my gloves already. Tell me in the meanwhile, did you experience any extra eye sensitivity lately, or any extra eye watering, redness, anything in particular? Okay, so if you don't mind, before we even get started, I would just like to come closer and have a look at the aspect of your eyes, okay? Just very delicately, by simply touching your skin around the eyes, gently lowering your lower lid, and gently trying to move your upper lid to just see how your eyes react to the simple touch, okay? Do I have your consent to come closer? Thank you. Okay, so I am just gently touching the skin around your eye, very delicately. Okay, good. Do you feel any pain or discomfort if I do so? Great. There is no excessive redness. Okay, I'm just now very delicately slightly lowering down the lower portion of the lid, okay? Just in the under eye area to expose a little bit of your orbital eye area. Okay, just very gently. Do you feel any discomfort if I do so? Good. Okay, now instead I am ever so gently placing my fingers and slightly pulling your upper lids. I'll be very delicate, I promise. So just very gently, if you can look down for me while I do so. Good. Okay. And now I'm doing the same thing with the other eye. Again, please look down for me. Very good. Okay. You can relax and blink. Good. Okay, as I said, I just wanted to see if your eyes are getting red too quickly, too easily, or watering too much. With this simple examination, everything looks okay so far, which is very good. Now instead, I want to have a look at your pupil dilation, so I will be shining a bright light into your eyes. I hope it's not too bothering for you. Just warning you, it's gonna be quite bright, okay? I'm going to ask you to find a spot in the wall behind me and just stare at that spot while I gently shine the light into your visual field to check how your pupils react, okay? Firstly, I will just do this with your eyes normally open, and then I will simply cover one of the two eyes, okay? Are you ready? Great. Find the spot behind me. I am coming a little closer, just to shining the light. Okay, keep looking at the spot behind me. Don't look at the light. I'm just checking to see how your pupils react to the light. Okay. Good. Very good. Great. Now, as I anticipated, I will be covering one of your eyes and just have a look at the reaction of the direct response of the eye that is not covered, okay? So again, spot behind me, just stare at it. As I flash the light, I'm covering one of your eyes, like this. Keep looking at the spot behind me as I have a look at your direct response. Is the light too bright? Okay. Keep looking at the spot. The response is working very well on this eye. Very good. Okay, just take a moment. And now we will repeat the same thing on the other eye. So again, find the spot in the wall. Make sure you stare at it as I cover the other eye. Good. And I'm just coming closer and flashing the light into your pupil. Please just always look at the spot behind me and don't move your head. Try to stay as relaxed as you can as I flash the light to see the direct response of your pupil. Everything looks fine here as well. Great. Okay, now instead, I would like to have a look at the consensual response of your pupil, which means that I am going to separate your visual field with my hand. I am going to again flash the light into one of your eyes, but I will be checking at the reaction of the other eye. Okay, so again, please do find the spot in the wall behind me. Okay, as I have a look at the facial response. So many people do not know that even if we stimulate just one eye with the light, the other eye as well actually reacts, and this is called consensual response. Okay, very good. Great. And now, please, we repeat the same thing with the other eye. So keep looking at the spot in the wall, okay? Great. Having a look at your consensual response again. Consensual response. Great. Very good. Good. Good job. You're doing a fantastic job. Okay. The consensual response is working very well. Great. Okay, fantastic. I just want to make sure that your visual capabilities are good before I go ahead with the peripheral views test. Okay, so just really quickly, I'm going to ask you to please cover one eye and read it here. Okay, so can you read the first line? Of course. The second line. Great. Why don't we just skip at this line right here? Can you read here, here, here? Great. Very well. Fantastic. So I'm just skipping right here, okay? Can you read here? Great. This one? Great. This one? Yes. A little bit of hesitation. Why don't we try with this one here? Here. Good. Please try again. Yes. This one. Good. How about this one? Not really. Yes. Great. This one. Okay, yes. Try to read here, okay? Here. Yes. Here. Yes. Here. No. Again. Okay, that's a C. This one. No. Yes. Good job. So you're just having a little bit of trouble, but you still can read it. Okay. Now cover the other eye. And I'm going to ask you to read again for me, please, okay? So, again, here, here, no trouble at all. Here, 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 great. This one here, good. Yes, perfect. Good job. Great. Awesome. Yes. Okay, so you're not having any trouble at all here. How about this line right here? This last line right here, okay? Yes. 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 Try again. Yes. Uh-huh. Again here, are you sure? That's a C. Okay. Okay. Alright. Okay, good. I'm really glad to inform you that your view is performing really, really well. So now I would like to perform this exam that is called the red saturation examination, okay? So which color is this? Red, yes. Do you have any trouble seeing this color? Okay, I now need you to cover one eye first and just have a look at this color. Yes, I will cover that for you, so I'm sure you don't cheat. Okay, and now I'm covering it with the other, I am covering the other eye, okay? Okay, so do you see any change? Do you perceive this color any different with one eye or the other? And if so, would you mind describing that in a percentage, like how different? 50% different, like 50% brighter, 75% brighter. Okay, very good. And now I'm going back to the light, okay? Because I also want to check at the brightness saturation. So I'm flashing the light into your pupils again. I'm sorry if this is a little too bright. Okay, so do you perceive any difference by just looking at it? Okay, I am now just making it pass. So look at my nose as I make it pass in your visual field. Good, like this. Keep looking at my nose. Great, and I'm coming back. Very good, keep looking at my nose. Okay. Do you perceive any difference in brightness when the light is moving, especially while it's shifting from one eye to the other? Okay, very good. And now, again, as we did before, I'm going to color one eye. Shine the light into one eye and then cover the other. Do the same thing, okay? So I am covering one eye. Just look at the light. I know it's very bright, but just a little bit of an effort here. Good job. Now I am uncovering the eye, giving you a little second to reset and adapt to the light changes. And then I am covering the other eye and doing the same, okay? Good, I'm going to cover the eye. Look at the light. I know it's very bright. I'm really sorry about that. Look at it for just another little while. Good job. Overall, again, do you perceive any difference in the brightness? And could you describe it in a percentage, if so? Okay, very good. Okay. Now I want you to follow the light, okay? Just with your eyes. Good. So do not move your head. Just follow the light with your eyes for me, okay? Here I am checking for any spasm, any irregularity, things of this sort. Everything is looking good so far. Keep following the light. Very good job. You're doing great. And again. And again. Great job. Now I want you to just follow the circular movement. Very good. And we change direction. You keep following. Very good job. Great. Now again, I have the light here. You tell me when it disappears from your visual field, okay? Yes. Good. Great. Good job. Mm-hmm. Okay. Yeah. Fantastic. All right. Now I am also going to ask you to again cover one eye and then the other. I'm just doing numbers with my fingers and I need you to tell me how many fingers do you see, okay? So firstly, could you please cover your right eye? Great. How many fingers? Yes. How many fingers? Yes. How many fingers? Yes. How many fingers? Good. How many fingers? Great. How many fingers? Good. How many fingers? Yes. How many fingers? How many fingers? Great job. Could you please cover your other eye and we do the same thing? Great. How many fingers? 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 Great job. Okay. Now I just want to delicately but a little more firmly than before touch your bone structure to see if there is any abnormal bumps or fracture or extra sensitivity to the pressure and abnormal pain, okay? And this will be the last part of our exam for today. Good. So I'm coming closer and just applying a gentle pressure around your orbital cavities. Please just tell me immediately if you're feeling any pain or discomfort, okay? Good. Great. Okay. Fantastic. Alright, the orbital and the visual exams are completed. I am very pleased to announce that everything is working perfectly. So, if you don't mind, I will just send you to our Dr. Periwinkle for the ear exam. Okay? She is amazing. For any extra information and link, everything is in the description box.
Hi, come on in. I hear you've been having some problems with your ears. Okay. So they've been giving you a little bit of trouble. Yep, I'm just gonna pop my gloves on. So if you can just describe to me what you've been feeling. Yep. So a bit itchy and irritated. Okay, right. So what we'll do is have a look at your ears and see what's been going on, okay? Alright then, so if we'll just start with this ear first. If you could just turn your head slightly. Okay, so I'm just going to have a look in with my otoscope here, okay? Now you shouldn't feel any discomfort, but of course let me know if you do, okay? Okay. And is the itchiness deep inside your ear, or do you feel like it's more on the outer ear? Okay, alright. So I'm I'm just going to be touching your ear. Okay. Let me know if you feel any pain or discomfort. Yep, and now I'm just going to tug down on your earlobe, okay? Yep. Any pain? No? Okay. We're going to go back in again with the otoscope now. Okay. Yep. Okay, so I can see a fair amount of wax build up in that ear. So let's go ahead and have a look in the other side, okay? So I'll start by feeling around the outside of your ear, and then we'll have a look deep inside. So if you can go ahead and just turn your head slightly the other way. Okay. Let me know if you can feel any discomfort. Okay, and again, tugging on your earlobe. Okay, good. So we're just going to be looking in now. Okay. Yep. Okay, so again, it does seem to be quite waxy in there. Alright, so what we can do, I can try to dislodge some of that, but we won't be able to fully remove it all today. So I will prescribe you some ear drops to take home with you. Okay? Yeah, but don't worry, I'll show you how to use them. But first of all, then, if I just go in and we can just do a little bit of a cleaning just to try and get some of that surface dry wax off and out. Okay? Fantastic. So, okay, you let me know if this causes you any pain. Yep. Good. Yep. Okay. Alright, and the other side. Okay. Okay, brilliant. So what I've done is just removed some of the wax that had dried and hardened during the middle part of your ear canal. Okay, and what that should do is just take away some of the itchiness and that irritated full feeling that's probably affected your hearing as well. Okay, what I would recommend that you do, I'll just grab one write you a prescription for Otex Express eardrops. Okay. Now, what you need to do is apply these twice a day, okay, in both ears, making sure you tilt your head fully on the side. It's good to do in bed, but lay a towel down over your pillow, okay, and make sure you let it rest for a good 5 minutes on each side. And what this will do is just to help dissolve and soften any of the remaining wax that made it deeper into your ear, okay? Brilliant. Okay, so I do hope that has helped for now. So over opposite the reception, remember when you came in and you spoke to the receptionist? Yep, just opposite her we actually have the pharmacy desk, and I will just fax over your prescription. That will be ready for you to collect in about 5 to 10 minutes. Okay, you're very welcome. Feel free to come back in 2 to 3 weeks' time. Just so that we can double check again and check that it started to dislodge. Okay, well, see you again soon. Goodbye. Bye.